Cancer survivor receives first penis transplant in the United States. Dr. Cetrolo estimated the cost at $50,000 to $75,000. Both hospitals are paying for the procedures, and the doctors are donating their time. Worldwide, only 2 other penis transplants have been reported, a failed one in China in 2006 and a successful one in South Africa in 2014, in which the recipient later fathered a child. Veterans are a major focus of transplant programs in the United States because suicide rates are exceptionally high in soldiers with severe damage to the genitals and urinary tract, Dr. Cetrolo said. They're 18 to 20-year-old guys, and they feel they have no hope of intimacy or a sexual life, he said. They can't even go to the bathroom standing up. Given the psychological toll, he said, a penis transplant can be life-saving. Dr. Cetrolo said the team would most likely perfect its techniques on civilian patients and then move on to injured veterans. It will also train military surgeons to perform the transplants. The Department of Defense, he said in an email, does not like to have wounded warriors undergo unproven techniques, that is, they do not want them to be guinea pigs, as they have already sacrificed so much. His team is working on ways to minimize or even eliminate the need for anti-rejection medicines, which transplant patients typically have to take. That research is especially important for veterans, he said, because many are young and will risk serious adverse effects, like cancer and kidney damage, if they have to take the drugs for decades. From 2001 to 2013, 1,367 men in the military suffered so-called genitourinary injuries in Iraq or Afghanistan, according to the Department of Defense Trauma Registry. Nearly all were under 35 and had been hurt by homemade bombs, commonly called improvised explosive devices, or IEDs. Some lost part or all of their penises. The Massachusetts General Team spent 3 years preparing for the penis transplants. The team did meticulous dissections in a cadaver lab to map out anatomy, and operated on 5 or 6 dead donors to practice removing the tissue needed for the transplants. Mr. Manning's operation involved about a dozen surgeons and 30 other healthcare workers. Dr. Dickon Coe, a team leader and the director of the hospital's regional urology program, said the team had not planned a set number of transplants. Instead, he said, the hospital will evaluate candidates one at a time and decide whether to allow surgery. For now, he said, the transplants will be limited to cancer and trauma patients, and will not be offered to transgender people.